Hi, I'm Becky Grainer. I'm a nurse consultant. Often we hear our colleagues say, "I should research that." What do they really mean? Nurses wonder about many things. Some would say we have a detective archetype. It is this curiosity that leads to undertaking quality improvement projects, seeking best practices, and conducting original research. This wondering has been named and studied as intellectual curiosity. This curiosity is very closely tied to fueling our drive for lifelong learning. Research is defined as a systematic inquiry that uses methods to answer questions or solve problems. The ultimate goal of research is to develop, refine, and expand knowledge. Nursing research is designed to develop trustworthy evidence about issues important to the nursing profession. Evidence for best practice is the synthesis of research findings to determine the best knowledge to guide care delivery. Evidence-based practice is defined as the integration of best research evidence with clinical expertise and patient values and needs in the delivery of high-quality, cost-effective care. So the next time you wonder about some aspect of patient care or nursing practice, remember your curiosity is the fuel that keeps the research flame burning. All nurses are expected to be able to integrate evidence and research findings into practice. The process can be as simple as sharing research with colleagues and peers. The North Dakota Center for Nursing wants to help you in your endeavor to meet this standard of practice.
Hello, my name is Dan Rusfang and I'm an advanced practice nurse, chronic wound practitioner, the practice at All True Health System in Grand Forks. I've had the privilege of working with patients that have chronic wounds, and today I'd like to talk about a lower venous stasis ulcer. We have found that in treatment of stasis ulcers, the best treatment involves some form of compression. When we see the patients that have this wound for sometimes up to 2-3 weeks or 2-3 months, after a complete full evaluation and some vascular studies, we're able to begin a course of treatment. And again, the dressings involve various dressings that include absorbency and so forth, but our evidence tells us that evidence-based practice involves compression. Some form of compression that a patient can tolerate can wear through the course of treatment, which has shown to give us the best outcomes.
Hello, my name is Stacy Fenning. I'm a nurse practitioner here in North Dakota. My favorite example of an evidence-based practice change occurred when I worked in the emergency department. As you know, evidence-based practice has an objective of increased patient satisfaction. And here in the emergency room, it was practice for us to do rectal temperatures on children 2 and under. And as you can imagine, this did not increase patient satisfaction. So what we did as a team, including the physicians and nurse practitioners and nurses, is we found about 7 articles that were up to date, all related to temperatures and accuracy in children under 2. And many of them were even in the emergency room setting. So we were able to refine our practice question. We got together as a journal club and investigated what our findings were after critiquing the articles. And what we found was that rectal temperatures actually the temperatures done by temporal artery thermometers are just as accurate as rectal temperatures on children 6 months and older, which greatly improved our patient satisfaction at the bedside.
Hi, I'm Shannon Elk. I'm a registered nurse at Sanford Hospital in Bismarck, North Dakota. I went to a college of nursing that proudly used evidence-based research. And my peer and I worked on a project where we studied using the ventrogluteal injection site versus using the dorsogluteal injection site. Our clinical question that we used for our evidence-based practice project was, for patients that receive intramuscular injections, does administering the injection in the ventrogluteal site reduce the risk for complications compared to using the dorsogluteal injection site? We reviewed 3 studies that overall talked about the advantages of using the ventrogluteal injection site and the disadvantages of using the dorsogluteal injection site. Unfortunately, there was limited research that had been done, but my peer and I did find 3 total studies that talked about the advantages of using the ventrogluteal injection site versus using the dorsogluteal injection site. The first 2 studies that we found talked more about the anatomy of the body and why the dorsogluteal injection site is not a good choice. The ventrogluteal site is the choice. the site of choice when needing a deep intramuscular injection. The other study that we used showed an overwhelmingly large percent of nurses that did not know how to locate or give injections in the ventrogluteal injection site. Since there was no current policy on the ventrogluteal intramuscular injections for the hospital, we proposed a change in that we should only use the ventrogluteal injection site and completely take out the dorsal gluteal injection site so that we don't create a risk for lawsuit or injury to our patients and ourselves. We planned on talking to the nurse educators and planned on doing hands-on educational courses and internet courses that would incorporate the information on how to locate that site and how to give injections there. And we would also do a skills lab to educate those nurses how to find the ventrogluteal injection site. Thank you.
Hi, I'm Shar Christensen. I'm an RN from Carrington, North Dakota, and I want to just talk a little bit about our medication packaging for residents and tenants in our assisted living that go out on pass. And in the past, they have had all their medications or had to take all their medications, or it was having to call in a nurse to come in and do the packaging when a lot of times they're not staffed by nurses. What we did was we worked with our local pharmacists to see what we could do to make it more convenient and safe for our tenants and residents to go out on pass. Upon working with them and the pharmacists, they've came up with a plan to help us out with medication packaging in blister packs. Each blister pack has every single medication listed on it with the dosaging and time that they're supposed to take it, thus making it safer for residents to go out on pass and also more convenient for family members to take their loved one out on pass. Overall, making it a lot more accessible for them.
My name is Paula Schmaltz. I'm an advanced practice registered nurse. My specialty is certified registered nurse anesthetist. I've done preceptors. I've worked with preceptors over the last 30 years. It's wonderful to see them develop under your leadership. Beyond, they share with us their studies materials, their evidence-based practice data. In addition, we offer to them our experience. Oftentimes, I think of registered CRNAs that have shared their skill, for example, in regional anesthesia. This is a practice that certainly has standards, but there's also the gifts that each individual brings to the field. And many of these individuals live on in the work of their students through the various techniques that they've acquired over the years.
Hi, I'm Kyle Martin. I'm the marketing coordinator with the North Dakota Center for Nursing. Today I'm going to show you how to use the Evidence-Based Practice Resource Center. So to get started, first visit our website at www.ndcenterfornursing.org. Once our page loads, simply roll over the Initiatives tab, and there you'll find a link to our Evidence-Based Practice Resource Center. By clicking that link, you'll be taken to a page that includes our introduction on this resource. You'll also find instructions on how to use the Evidence-Based Practice Resource Center on this page. But for today's video, let's go ahead and take a look at it. After the page loads, you'll find all the different topics that we have available on our Evidence-Based Practice Resource Center. Simply click on the tab or the title of the name on the tab, and you'll find more information on that topic in that tab. As you can see, there are quite a few available here. Next, let's go to Elements of Evidence-Based Practice. Now that our Elements of Evidence-Based Practice page is loaded, you will find instructional resources listed here, including links to worksheets and other national websites. Simply click the link on the resource that you would like to learn more about. Finally, let's go back to the main menu of the Evidence-Based Practice Resource Center. On the bottom of this page, you'll find instructions on how to submit your resources. This couldn't be easier. To submit your resources for inclusion in our Evidence-Based Practice Resource Center, please email them to the North Dakota Center for Nursing Executive Director, Patricia Moulton, at patricia.moulton@ndcenterfornursing.org. You can use this link or simply just type in her email address into whatever email program you use. Thank you again for viewing this video today.